Hey guys, I'm Hannah Bender with Medical Missions Outreach, and I'm here to talk about some tips on precepting a student on an MMO trip. Many of you are familiar with the concept of precepting students in your workplace. Maybe some nursing students came to your hospital and shadowed you, but I want to talk specifically about some tips that not only you can use in your workplace or wherever you may precept a student, but also with students traveling with Medical Missions Outreach on a trip. Some of these students may be high school students just on the trip because they are interested in missions and think maybe they would do something medical. They may be primarily shadowing you. Other students may be nursing students, pre-med students, public health majors, physical therapy. There's a wide range of students who are also, like you, interested in coming on a short-term trip and seeing what it's like to use medical missions to point other people to the great physician. I wanted to start by telling you a little bit about who it is that you may be precepting on our trips. So the first tip is learning about your student. These students are coming from a variety of colleges across the US and also some high schools. Some students coming on a trip asking to shadow with a provider may have no experience whatsoever in healthcare and may want to see if it's something they want to do as a career down the road. Other students are pretty far in their career process, or at least in the training level. Some students will be nursing students, medical students. All of this is helpful for you as you interact with your students. A senior student may seem like they would all be the same, but if you're dealing with a senior nursing major, she or he has had tons of experience with patient care. They've done hours of clinicals, they've prepped a lot in the labs, they've had a lot of lectures dealing with all kinds of health difficulties. But if you're dealing with a pre-med major, they may have a lot of the science under their belt. However, no patient interaction at this point. So the biggest thing is learning about the student. Take some time to, yes, find out where they're from, ask them their favorite sports teams, but ultimately get to know where they are in their educational process. Some students also have already received training and become CNAs on their own and will have a lot of familiarity with patient interaction. These are all helpful things for you to know as a preceptor when you're trying to train your student. The next tip that I have for you is to involve your student. This may seem like a no-brainer. Of course, you're going to involve your student, but I want to get into some specifics. When you're doing assessments, be sure that you're involving your students. Sometimes a student may feel a little uneasy about jumping into an assessment. I do have a webinar with all students prior to trips to give them some confidence to get involved, to listen to lung sounds and heart sounds behind their preceptor, to get a feel of what it's like to listen to patients if they haven't already. This is also helpful. I've had a student in the past who came into this and I said, "Oh, go ahead and listen to his heart and lungs." And he stared at me. He had never set a stethoscope on a patient. So again, having that baseline, you've already learned about your student. They've never touched a patient in their life. That will help you in how to go about involving them in your assessment. Be sure to differentiate between normals and abnormals. Certain things that we do as providers come secondary to us. We don't even think about what we're looking for. If we have a patient coming in with a skin complaint and we start looking between their hands and their toes and underneath their armpits, a lot of times we're doing that to differentiate if this could be a scabies infection. While a student may have no idea, they just see a provider quickly glancing over everything and telling them there's scabies, they may look at the sore and focus on that as the only piece that led the provider to making that diagnosis. So talk to your students while you're doing assessments. Tell them, hey, this is what a normal ear looks like. Do you hear that? That's called stridor, and explain. Again, we know that our patients in clinics have been waiting hours in line, so we don't want to spend all of our energy on students. But a comment here or there can make a world of difference in how they understand and interact throughout the clinic week. When thinking of abnormals, how many of us haven't gone into a patient room, done a full assessment, and then returned to the chart to chart the assessment and realized, oh, wait, the patient had a murmur? I never noticed that. Or, wait, their legs are different lengths? This happened to me just recently, and sure enough, going back in the room, you realize that they are slightly different when you know what you're looking for. So help your student to know what to look for with certain patients as they come in with their chief complaints in clinic. Another step involving your student in your assessment would be in the interview process. When you see that chief complaint, often you're going through asking a certain set of questions. Once a student has worked with you for half the day, they may feel confident doing some of the questioning regarding a headache. They know what to ask. How long has it been going on? What makes it better or worse? Are you bothered by bright lights? What's your water intake like? If you are repetitively asking the same questions, feel free to ask your student if they feel comfortable doing some of the interviewing at the beginning. Again, this helps them to feel involved, but also learn through the process. If you find that your student is kind of sitting back and not very involved at all, feel free to encourage them by giving them a heads up. The next patient that comes in with this, I want you to ask these questions. That can help them to stay engaged during the whole process. The third way that you can involve your patient, not only during the assessment process, during the interview process, but also as you're doing teaching. This is very similar. Again, don't throw a student into teaching if you don't know their knowledge base, but if they're working with you consistently and have a good idea of it, specifically if they're in their senior nursing year or in medical school, they do have a knowledge base to share with patients. Please involve them and let them feel like they're making a difference in the patient's life during that interaction. The last way to help your students be involved during the patient interaction portion is in procedures. We do get a lot of questions about this, and especially when I'm recruiting at colleges and universities, everyone wants to become a surgeon on these trips. Everyone wants to suture up a wound or tell their family the coolest thing they got to do while they were on a mission trip. But this is not our goal. At Medical Missions Outreach, we want to be ethical in everything we do, and that means that students will continue to practice in the same scope in which they would in the States. You're never going to see a high schooler suturing things up on anyone in the United States. Nurses don't suture in the United States. RNs, LPNs, none of those people are typically the ones doing those procedures, and they won't be the ones doing the procedures in our clinics either, whether they're students or whether they're actual RNs. The suturing and a lot of procedures are reserved for advanced practice providers, as well as people studying who have been trained in those roles. An NP student or PA student may assist you in those type of procedures according to your judgment. If you do have questions about this, please reach out to me, Kelly, our medical director, or whoever is serving as an MMO staff member in the clinical lead role during the week. Final tip: you've learned about your student, you've involved your student, it's time to impact your student. Obviously, you're impacting your student throughout this whole process. Just the fact that you're including them and allowing them to be a part of the interaction with patients is huge. We are seeing a massive exodus of healthcare workers, and this is also true of medical schools and nursing school programs. We want to be part of the change to be able to allow students to feel supported during their week and invigorated to continue to work as a healthcare worker. Some students may be coming with no idea of what they want to do with their life. This is a great opportunity for you to share your story. Tell them what made you interested in medicine, in nursing, in public health, wherever you are. Share that burden with them and explain to them also how you continue to do it amidst everything going on around us. We do have an extra hope in the Lord who gives us the sustainability to continue to work when we're drained, when we're tired, when we're exhausted. This is a great opportunity for you to impact your student and share that, again, not only how the Lord led you to this place, but how he continues to sustain you. And honestly, it's invigorating, at least for some of us, to be around students. They have fresh energy, fresh eyes. Everything is beautiful in medicine. Let's continue to promote fostering environment for them as they come on these trips. That may look like continuing to talk with them after the trip is over. Follow up with them. Give them realistic feedback throughout the week. If they are struggling, feel free to encourage them on some ways to improve. Granted, you only have one day with them, so there may not be any groundbreaking discoveries or conversations happening, but every little interaction is an encouragement. I have the special privilege of being not only in the teaching role, but also the student role right now as I go for my nurse practitioner degree. I had a preceptor recently who invested and talked through every detail of everything we were doing, but the most impactful moment for me working with this provider was him explaining that I had a good demeanor with my pediatric patients, something I was very uncomfortable about, but bringing that up as a strength meant the world to me and encouraging me that I would continue to pursue excellence as I grew as a provider. These little conversations can make a world of difference to students. Thank you again for watching this video, for sharing your knowledge with our students and your passion for medicine and for patients. We're excited to work with you soon.